No more bronchitis. Bronchitis is divided into acute and chronic. In addition to persistent cough, it may also progress to bronchiectasis and pulmonary fibrosis, affecting lung function. The bronchi are the channels through which air enters and exits the lungs. When the bronchi are irritated or infected, bronchitis may occur, secreting a lot of mucus, causing obstruction of the respiratory tract, and symptoms such as coughing, sputum production, or difficulty breathing. Bronchitis is divided into acute and chronic. Acute is usually a short-term inflammation of the bronchial tubes. Most of them are caused by viral infections, such as common colds or flu. A small number of them are caused by bacterial infections, such as Mycoplasma pneumoniae. Other irritating gases such as air pollution or inhalation of allergens, cold air, chlorine, carbon monoxide, etc. may also cause acute bronchitis. Chronic bronchitis lasts for 2 consecutive years, with symptoms such as coughing and phlegm recurring for more than 3 months in a year. The causes of long-term bronchial irritation and repeated chronic inflammation include the persistence of allergens, smoking, air pollution, climate change, inhalation of irritating objects, or repeated upper respiratory tract infections, asthma, emphysema and other chronic lung diseases, which are common for smokers or workers in dusty environments. Some acute bronchitis may evolve into chronic bronchitis because the cause of acute bronchitis persists and the bronchial tubes are repeatedly infected and destroyed, eventually evolving into chronic bronchitis. Symptoms of bronchitis include dry cough, cough with phlegm, chest tightness, chest discomfort, noisy breathing, fever, easy fatigue, etc. The symptoms of acute and chronic bronchitis are slightly different. Symptoms of acute bronchitis. The main symptoms are similar to those of a cold, such as dry cough, headache, fever, nasal congestion, runny nose, chest tightness, body aches, etc. In severe cases, it may be complicated by pneumonia. Symptoms of chronic bronchitis. Cough with phlegm and a lot of sputum, like foamy mucus, and symptoms continue to occur repeatedly, and breathing difficulties may occur. Fever is rare or only low grade. It often occurs in winter, because cold air can irritate the bronchial tubes, induce respiratory tract contraction and secrete mucus. Some patients with bronchitis will cough until they have blood streaks. This is usually caused by excessive coughing that causes damage to the mucous membrane. It is more common in patients with chronic bronchitis. If the entire bronchi has been destroyed, causing bronchiectasis, the amount of blood coughed up may be greater. Acute bronchitis. Acute bronchitis is mostly caused by viral infection. If it is confirmed to be influenza, antiviral drugs will be given. Otherwise, symptomatic treatment will mostly be given, such as anti-inflammatory analgesics, cough suppressants or bronchodilators, etc. to help relieve inflammation, smooth breathing, and dissolve thick phlegm and mucus, plus take proper rest and replenish fluids to allow the body to heal itself. If acute bronchitis is caused by a bacterial infection, antibiotics will be given. Acute bronchitis usually improves gradually within 1 to 3 weeks. Chronic bronchitis. Chronic bronchitis is difficult to cure because it is caused by repeated inflammation. Treatment is mainly focused on controlling and alleviating symptoms. The doctor will provide treatment based on the patient's condition and severity. If phlegm occurs repeatedly, the doctor may give phlegm-reducing drugs and drink plenty of water to help cough up the sputum or dilute the sputum. If there is a concurrent pneumonia infection, antibiotics will be used to fight bacteria. For patients with chronic bronchitis, bronchodilators may also be prescribed to relieve bronchial mucosal edema and muscle spasm, and help the airways dilate and breathe smoothly. Patients may also be asked to perform lung rehabilitation exercises to increase lung capacity and help cough up sputum. Some patients may even have their lung function seriously affected and must be given oxygen to maintain blood oxygen concentration.